Good morning, medical students. Today, we will delve into the fascinating field of radiology, specifically focusing on sentinel lymph node mapping. This advanced imaging technique plays a crucial role in the detection and assessment of tumor metastasis, aiding in the accurate staging of various malignancies. Through this comprehensive script, we aim to provide you with a detailed understanding of the principles, techniques, and clinical applications of sentinel lymph node mapping. Sentinel lymph node mapping represents a cornerstone in the management of cancers, such as breast cancer and melanoma, by identifying the first lymph nodes receiving the primary tumor's drainage. This procedure allows for targeted diagnostic and therapeutic interventions, reducing the need for more invasive procedures like lymph node dissections. The discovery of sentinel lymph nodes has revolutionized cancer treatment, resulting in improved patient outcomes and reduced morbidity. Knowledge of lymphatic anatomy and drainage patterns is essential for accurate sentinel lymph node mapping. The lymphatic system comprises a complex network of vessels that transports lymph fluid, which contains immune cells, proteins, and waste products. Understanding the anatomical landmarks and the variations in lymphatic drainage patterns is crucial for successful identification and localization of sentinel lymph nodes, ensuring precise staging and targeted treatment. To comprehend the significance of sentinel lymph node mapping, it is imperative to understand the principles of tumor metastasis. The spread of cancer from its original site to distant organs or lymph nodes is a complex biological process. By identifying the sentinel lymph nodes, we can gauge the extent of tumor dissemination and develop appropriate treatment strategies. Consequently, sentinel lymph node mapping serves as a vital tool in the assessment of metastatic disease and aids in making informed clinical decisions. Radiopharmaceuticals are key components in the imaging technique employed for sentinel lymph node mapping, known as lymphoscintigraphy. This topic discusses various radiopharmaceutical agents, such as technetium-99m sulfur colloid and technetium-99m nanocolloid, which are commonly used to visualize lymphatic drainage pathways and localize sentinel lymph nodes. Understanding the properties and applications of these radiopharmaceuticals is essential for optimal planning and execution of the imaging procedure. This segment offers a comprehensive overview of the different imaging techniques utilized in sentinel lymph node mapping. It covers modalities such as lymphoscintigraphy, single photon emission computed tomography, SPECT/CT hybrid imaging, and ultrasound guided mapping. Each technique has unique advantages and limitations, allowing radiologists to employ a multimodal approach for accurate sentinel lymph node identification and localization. Magnetic resonance lymphography, a non-invasive imaging modality, has emerged as a promising tool in sentinel lymph node mapping. Through detailed anatomical and functional information, magnetic resonance lymphography aids in identifying sentinel lymph nodes and evaluating the extent of lymphatic drainage. In this section, we explore the principles, techniques, and clinical utility of magnetic resonance lymphography in the context of sentinel lymph node assessment. Hybrid imaging techniques, such as SPECT/CT and PET/CT, have revolutionized the field of radiology. This topic evaluates the role of hybrid imaging in sentinel lymph node mapping, providing insights into its ability to combine anatomical and functional information for precise localization and characterization of sentinel lymph nodes. We discuss the advantages, limitations, and potential future developments in this evolving field. Intraoperative imaging techniques, including gamma probe localization, facilitate real-time identification and localization of sentinel lymph nodes during surgical procedures. We explore the principles and techniques involved in intraoperative imaging and discuss the advantages and challenges associated with these methods. By integrating intraoperative imaging with preoperative mapping results, surgeons can ensure the accurate identification and excision of sentinel lymph nodes. Histopathologic evaluation of excised sentinel lymph nodes aids in determining the presence or absence of metastasis and provides crucial information for cancer staging and subsequent treatment planning. This section elucidates the histopathologic techniques employed, the role of immunohistochemistry, and the significance of establishing standardized protocols for sentinel lymph node evaluation. Accurate histopathologic assessment is pivotal in guiding patient management decisions and assessing prognosis. Advances in molecular methods have revolutionized the field of sentinel lymph node analysis. This topic explores molecular techniques, including polymerase chain reaction, PCR, next-generation sequencing, and gene expression profiling, which can enhance the sensitivity and specificity of metastasis detection within sentinel lymph nodes. We explore the evolving role of molecular analysis and its integration into routine clinical practice. The field of radiology continuously witnesses the emergence of novel techniques for sentinel lymph node mapping. This segment investigates the latest technological advancements, such as fluorescence imaging, photoacoustic imaging, and hybrid imaging with novel radiopharmaceuticals. By adapting and integrating these cutting-edge techniques, the accuracy and reliability of Sentinel lymph node mapping can be further improved. This final topic explores the diverse clinical applications of Sentinel lymph node mapping across various malignancies, including breast, melanoma, head and neck, and gynecological cancers. We delve into the controversies surrounding the technique, such as the false negative and false positive rates, the impact on surgical decision-making, and the balance between minimal invasiveness and accurate staging. Understanding these clinical nuances is imperative for comprehensive patient care. Sentinel lymph node mapping is a powerful tool in radiology for assessing tumor spread and optimizing patient care. This video has covered the principles, techniques, and clinical applications of this imaging method, equipping you with valuable knowledge to improve cancer management. Thank you for watching, and keep exploring this fascinating field.